Hi, my name is Ashleigh and I have acromegaly. I wanted to talk to you about my decision to switch to Palsonify. I was diagnosed in 2011 and had my pituitary tumor removed right away, but my IGF-1 levels were still high. So I started on injections. The injections were painful and I felt like they were sucking the life out of me. My doctor told me about a clinical trial that was available for Palsonify. I was hesitant to try anything else, even though I felt cruddy on the injections, they were managing my IGF-1 levels. But I decided to give Palsonify a try. I've been waiting for the clinical trial to be over so I could shout it from the rooftops, as my experience with Palsonify has been what I was hoping for. My doctor said my IGF-1 levels are ideal for what my range should be. I did have some side effects when starting Palsonify. I had some stomach pain, diarrhea, and nausea, but those things mostly went away after the first few weeks, and if they came back, they were mild for me. Living with acromegaly can feel like a lonely place, so if I can reach one person who might have the same anxiety I did about switching treatment, it will all be worth it. I only wish Palsonify was available years ago.
What is PALSONIFY paltusotine? PALSONIFY is a prescription medicine used to treat adults with acromegaly, for whom surgery was not effective or surgery is not an option. It is not known if PALSONIFY is safe and effective in children. Important safety information. What should I tell my healthcare provider before taking PALSONIFY? Before taking PALSONIFY, tell your healthcare provider about all your medical conditions, including if you have gallbladder problems, have blood sugar control problems, low blood sugar or high blood sugar, have problems with low heart rate, are pregnant or plan to become pregnant, it is not known if PALSONIFY will harm your unborn baby, are breastfeeding or plan to breastfeed. It is not known if PALSONIFY passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take PALSONIFY. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. PALSONIFY may affect the way other medicines work, and other medicines may affect how PALSONIFY works. Especially tell your healthcare provider if you take any medicines that can slow the heart rate. Know the medicines you take. Keep a list of them to show your healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of PALSONIFY? PALSONIFY may cause serious side effects, including gallbladder problems. PALSONIFY may cause problems with a gallbladder. Tell your healthcare provider if you have sudden pain in the upper right area of your stomach, abdomen, sudden pain in your right shoulder or between your shoulder blades, yellowing of your skin or the whites of your eyes, or pale stools. Blood sugar problems. PALSONIFY may change hormone levels, potentially causing either high blood sugar, hyperglycemia, including diabetes, or low blood sugar, hypoglycemia. Tell your healthcare provider if you have problems with high or low blood sugar. Your healthcare provider will check your blood sugar when you start taking PALSONIFY or when your dose is changed. Heart rate problems. Tell your healthcare provider if your heart is not beating normally. Thyroid problems. PALSONIFY may keep your thyroid from releasing thyroid hormones, leading to hypothyroidism. Your thyroid function may be checked periodically during your treatment with PALSONIFY. Fatty stools. PALSONIFY may cause your body to have problems with absorbing dietary fats. Tell your healthcare provider if you have any new or worsening symptoms, including fatty stools, changes in the color of your stools, loose stools, stomach, abdominal bloating, or weight loss. Low vitamin B12 levels in your blood. Your healthcare provider may check your vitamin B12 levels during treatment with PALSONIFY. The most common side effects of PALSONIFY include diarrhea, pain in your stomach, abdominal area, nausea and vomiting, decreased appetite, slow heart rate, bradycardia, high blood sugar levels, hyperglycemia, and irregular heartbeat, palpitations. These are not all the possible side effects of PALSONIFY. For more information, ask your healthcare provider or pharmacist. You are encouraged to report negative side effects to Crinetics Pharmaceuticals at 1-833-CRN-INFO, 1-833-276-4636, or FDA at 1-800-FDA-1088, or www.fda.gov/medwatch. Please see full prescribing information, including patient information, at palsonify.com and talk to your doctor.